I think we can't like DBT our way out of the fact that there is like safety concerns, there is discrimination, there is, right, like not laws in place that it's like, if, we don't have to hire you if you check this or this, right? Like that all exists. So I think it's one acknowledging that and not, again, not naming that and being able to talk about that. And also, I think then safety, security can start then within that environment of home, of parent-child connection, of caregiver, right, and youth connection.
Welcome back to the Into Place Therapy podcast. My name is Isabel, and I'm a certified eating disorder specialist and licensed clinical social worker in Arizona. So in today's episode, we're exploring how caregivers can show up with compassion and affirmation for LGBTQIA plus youth navigating eating disorders. I'm joined by Winter Groschel, a member and advocate of the LGBTQIA plus community and an experienced licensed therapist in Arizona specializing in eating disorders. They bring a deep understanding of how identity, nervous system regulation, and family support intersect in the healing process. So whether you're a caregiver, clinician, or ally listening today, this conversation aims to offer insights on how to create safety and connection for the LGBTQIA plus youth in your life. So, Winter, I'm really grateful to you for joining me today.
Oh, it's so good to see your face. Thanks so much for having me.
Yeah, you're super on board and willing to be part of this and didn't even hesitate, so...
No, when it comes to you, I was like, yes, absolutely. That's an easy, I know for me, decision making. Sometimes I'm like, I got to think on this. And this one was an easy, like, absolutely in. So very grateful to be here.
Yeah. Thanks, Winter. So, before we jump in, I do just want to acknowledge, with the audience that LGBTQIA plus is a very broad term and it encompasses a wide range of identities and experiences. And so today's conversation is absolutely not meant to capture that. And really the purpose is to contribute to what is an ongoing, much larger dialogue. So with that, to start us off, Winter, can you share with us why LGBTQIA plus youth, especially trans, non-binary, and gender non-conforming folks, are at a higher risk for eating disorders?
Yeah, absolutely. So I think when thinking about this question, like you said, the community aspect of people in the LGBTQIA navigating mental health issues in general, the data kind of reflects that there are multiple pieces, whether it be depression, anxiety, PTSD, that this community is navigating. And so with that, when I think about eating disorders specifically, I'm really looking at this as a coping skill, right? Like eating disorders evolved to have a function for humans. So typically when we're looking at the lived experience of a minority group, it's like, yes, this was the function of this eating disorder was survival for a lot of the time that you were using it. So for me, I think about, right, like we're using this to be able to fit into a society that very much runs off of black or white, all or nothing, right or wrong, binary views of gender. So the use of eating disorder, the function of eating disorder is then to be able to fit into community, because if we feel like we're not part of a community, that can be really detrimental to psyche. So I think the function is, again, survival, trying to connect. It's also trying to feel safe in our bodies if that is a space that we don't feel like we have any safety in, whether that's our gender identity, our body image. And then again, you have the whole piece of discrimination, bullying, right? Just trying to feel safe navigating social spaces as a member of a minority community. Yeah.
Yeah. And I mean, you're bringing up so many points also about like very much, how that would intersect with being a youth and bullying, especially, which obviously can happen at any stage of life. But I think especially so around that time. And, everything you're sharing about sort of identity related experiences that do tend to show up in an eating disorder. And so can you also kind of elaborate that in terms of like how it might show up in their relationship with food, right? Or their body?
Yeah, absolutely. So when I think about the term eating disorder, back when I was kind of learning more about eating disorders, I think my perception, until I kind of really understood more, was, oh, this just impacts, right, like white females who are cis presenting, right? And that actually is not accurate at all. So typically, again, we're seeing many different individuals struggling with disorder eating disorder, and that can show up in a myriad of ways. That can show up as restricting our food intake, whether that's actual restricting of food or mental restriction of having morality of food rules around food. Can't have this because of X. That can look like struggling with sensory issues related to food, right? So if we're looking at avoidant restrictive food intake disorder, sensory issues, fear of vomiting, fear of choking, texture, things like that, that can be really averse. It can look like, eating in a large quantity of food in a short period of time and then using compensatory behaviors like self-induced vomiting, so purging, laxative use, exercise, misuse of insulin. It can look like, again, just struggles where it doesn't even, from the outside perspective, someone would never know that someone is struggling with a food related component because we kind of normalize doing weird things with food. So it may also just look like, again, struggles internally with our own sense of self, our body image, right? Food rules that no one else knows about and we present as very typical in the world. But again, we're really struggling with our own shame, pain around our relationship with food and body.
And, for caregivers, right, or parents, like what might this look like in a really young person, from the outside?
Yeah. Yep. I think because I think automatically we may think that we're going to look for the physical presentation of how an eating disorder or disordered eating could present. So I think sometimes when I'm working with a family, caregivers have this idea that, well, my loved one looks fine. They're at an appropriate weight or weight versus height, or their, their growth charts are still on trajectory. And that isn't always the full picture. Same thing with blood work, right? Blood work could come back great, but again, the body is really smart and could be creating that sense of homeostasis. So I think, again, looking at is there discomfort around food activities? Is there sense of anxiety around, I thought we were going to have this and now we're going to a restaurant and I'm feeling really anxious about that? Is there, right, like what's the kind of the nervous system telling us that maybe the physical attributes of like weight loss, weight gain, weight fluctuations might not tell us? Mental health wise, right? Are we noticing isolation? Are we noticing disconnection? Are we noticing maybe hiding foods, hiding when there's foods present, not wanting to hang out with friends because, again, comments are being made at school around body or food relationship? So kind of, I think those are more of the things that I start kind of with first. Obviously, if there's physical presentation that's concerning as well, we're going to look at and address that too. But I think with caregivers, it's really looking at maybe the other pieces that could be present that have nothing to do with, physical presentation.
Yeah, and I think that's such an important point too of like many thoughts and thinking and feelings precede any behaviors in the first place. And so that being something that is just as important and significant as any behaviors that might be happening that do often get missed and by providers, included in that too. So I appreciate that point you're making. And what are some simple, meaningful ways that caregivers can make their home feel safer and more affirming for queer and trans youth who are in recovery?
Yeah, I think while I may be a provider in this space, I really, really open up the conversation with caregivers and their loved one to talk about that loved one is going to be like the best sharer advocate of what they need personally. That all the tips and skills and tools that I can throw out there, it's going to be really important that the individual feels like it's helpful for them, because I can teach all of the, breathing techniques or grounding things, but if that's not going to jive with the person, that it's again not helpful. So I think first it's opening up the conversation of how can we really encourage open communication of, when we go into this experience, whether it is eating at a restaurant, whether we're just starting to talk about how we can support someone who is navigating an eating disorder, what's going to be maybe helpful for this person and what's not, with the understanding that sometimes when someone is struggling with disorder eating disorder, trauma in general, anxiety, fill in the blank, that they can say when they're in a calm nervous system, like, hey, it would be helpful if you could check in with me like this. And then when we're in a disrupted, dysregulated space, I go to check in with them the way that they asked. And they're like, actually, no, that's just not helpful. So I think it's just recognizing this is going to be trial and error, because I think parents are terrified, caregivers are terrified that they're going to make the eating disorder worse or the depression worse or whatever it is. And I think kind of removing that fear and just saying, like, again, what makes it worse is not talking about things, is not checking in, not asking questions. And really being able to have dialogue around this, I think, is kind of the first piece that I really, really encourage. I think then kind of that step next is like thinking about just the environment in general within your home and what types of I think like environmental pieces, whether it's, it would be really helpful to have representation of different queer artists that I love, or musicians, or I think having a conversation with your loved one, again, of like what specifically they feel would be meaningful to them as far as making that space, because it's their space too, right? Like, how can we make sure that everyone feels just, again, represented and seen?
Yeah, and that coupling of like communication and obviously, sharing the affirmation from a verbal standpoint, but then there are all these ways that beyond words that also send those messages too, and especially with youth who I think are very sensitive.
Oh, and they pick up on everything. Exactly. I can wear a certain like band t-shirt and it just becomes the like, center of the discussion. So I think even in small ways, caregivers can cue to safety of like, even being interested in different, books or different social media things that your loved one is interested, or, I think especially again, just finding those like ways of connection, because I think that speaks really highly to just the desire to learn and to be supportive of your loved one. And they pick up on that, right? They feel that.
Yeah, and with what you said too around having those conversations, like a lot of families I work with describe like walking on eggshells or feeling like they're walking on eggshells, and sometimes there's this whole buildup that happens to the meal or after the meal, whatever it is, and then this is what everyone tries to communicate, and it becomes obviously very overwhelming for the youth and for the families too. And so I think that point is so important of like, these conversations can actually maybe be diffused or a little bit easier to navigate when we're outside of that dysregulated state.
Yes. Yep. Like maybe start practice having those conversations then, not right before mealtime or during mealtime, or like kind of quarterbacking it of like, well, this went really poorly. What can we do? Like 2 minutes after the meal, right? Like really finding a time where we're both regulated and kind of coming up with some ideas, again, to trial and error, that we can, again, go in with some ideas, some resources, some tools, and honor that if loved one needs something different, they're able to communicate that to us. And we don't need to take that personally, right? Like it's not a failure on the caregiver's end if loved one is communicating that they need something different in those moments.
And that allows for, people to change and people to change their minds and kind of have that relationship be fluid, which allows the caregiver, I think, youth relationship to be strengthened in that process.
Yeah. Yeah. Which I think just like I love the way that you put that, because I think that's a beautiful analogy around just, inviting change with your kiddo in general, not only around mealtime and what they might need, but I think that also transfers to then like change if we're using different pronouns now, change if we are navigating just again stuff coming up around our body image or gender dysphoria, right? Like I think that just allows then if we can go in with this mindset of I'm not failing as a caregiver, I can be flexible in kind of taking this feedback and knowing that this is going to be kind of a roller coaster at first, but that's okay. It's not, again, a failure. I think that really, that kind of softens us then to be able to receive that feedback with a more regulated nervous system instead of shame that might be coming up.
And, you know, you just said nervous system. And so, you know, this can bleed, of course, into polyvagal theory, acceptance and commitment therapy, dialectical behavior therapy, all of which I know you use in your work. And, you know, I understand that's a lot of words for those listening. You know, I'd say maybe two main themes, and I'll let Winter elaborate. But in those frameworks, you know, there's a focus on values and also of supporting our nervous system. So, Winter, can you talk a bit about how those approaches can support the youth that we're talking about today and how caregivers might start using those tools?
Yeah. Yep. So I think within the different, like you said, therapeutic modalities that we use, right? Like with your youth, right? Like I really like to also bring them in as far as family context or caregiver context or just support system in general, because I think they're just really lovely ways to help us navigate maybe stressors in life in general. And then it's giving verbiage. It's kind of I think allowing for this understanding of what your child or youth is going to be learning about while they're in their own therapy as well, so that we're kind of reinforcing then, you know, whatever they're learning in therapy, we're also doing at home. Because I think sometimes there's this big disconnect of youth is trying to use these new skills or use this new verbiage with their therapist or their treatment team. And then families just like really confused. And there's been a homeostasis that's been created that now we're kind of changing, and that can feel disruptive or disorienting at first. But I think the more we can kind of all help, you know, the family system or the caregiver and the youth kind of navigate this verbiage, it can be really helpful. So one of the first ways that I do that is, and there's many ways you can do that, but I think really starting to identify how does my nervous system show up when I notice my youth is struggling or my loved one is struggling. Because I know for me, right, like whoever it is, someone's struggling. I may have been a therapist for a long time. My immediate human reaction is like, oh, let me just put my fix it helper self on, right? And I want to come up with I'll give 27 ideas of how we can calm the nervous system. And that person gets really flooded and overwhelmed. And then I'm like, oh, well, now I'm shut down because I just tried to help, right? So it's immediately pausing and noticing when I see loved one struggling, they're really, again, struggling with anxiety, eating disorder. They're coming home from a really hard day at school or work where they have been navigating discrimination. How can I first regulate my own nervous system and really soften into, right, like this is a space that I don't need to let that little part of fixing that come in. How can I just be there to support? And so that might sound like, hey, I noticed that your body language is saying this. What do you need from me right now? Do you want to just talk about sunshine and rainbows? Do we want to go distract and watch our TV show together? Do you want to go take a shower and then we can try and have snack? Like, what can we kind of do to help? Then maybe bring in some ideas, but it's coming from a very different space than they come in and I'm immediately like, what's wrong? What's going on? What happened at school? Right? Like that's very different nervous system wise when we're approaching it that way. So that in short, right? Like short and fast version of how maybe we use nervous system regulation. I think within the relational dynamics with your loved ones, I'm also identifying what are their values. So what are the things that we value as humans, whether it's you know, again, equality, honesty, transparency, authenticity, and also being able then to talk about as a family context or a support system, right? These are my values. So if I'm struggling, this is something that helps me kind of anchor to like, this is the why as to why I'm doing this on my hardest days is because I want to be able to move to New York and have this amazing career in the future because that's what I value. Or, right, like, again, it's just kind of knowing and for us as support systems and for your loved one of how we can use values to kind of ground and anchor and move into that committed action. And then that third piece of DBT, so dialectical behavioral therapy, really it kind of looks at many different pieces, but it overviews, right? How can we support emotion regulation, interpersonal skills, mindfulness, kind of looking at these pieces, not only for your loved one, but then also in the home, right? What type of skills can we use around practicing, which we all can, a little bit more mindfulness around mealtime, mindfulness around my tone and how I approach a conversation. How can I notice if my emotional regulation is kind of escalating, and what do I do to kind of bring that back down? So I think for when I'm working again with families or support systems, being able to use the same skills that we're talking about in individual therapy to kind of bridge that gap of how can we transfer these supports into the home or with our caregivers too, to help them feel more empowered.
Mhm. And, with the how do we make these skills like transferable and apply these things, I really appreciate that, because I think as a therapist, that's something that if that doesn't happen, then what are we doing here? So
Real hard. Yeah. Yeah. Yeah.
and with that, of course, when we bring in a family, we're bringing in multiple people with all sorts of values and entry points. And unfortunately, something that I've seen a lot is not everyone being on the same page in the family. And so for families where maybe there's one caregiver who is very invested and is very affirming, and another one who isn't, how, and this is extra bonus question, really difficult, but I would love to hear what you think about, how would you approach that, right, as a therapist, and what are your thoughts there?
Yeah. Yep. I think the first thing that I think of doing is I check in first with my client, right, with my adolescent or, early teen. Typically there's an understanding there of, this family member does struggle to show up for me in ways that this family member does. So there's kind of a sense already of grief. And so I think the first piece is just kind of walking through that grief, as well as, looking at from a lens of, as humans, we're very complex. So they may sense that there's a part of their family member that wants to be able to show up for them. And it maybe is like lack of education or terrified or fear, right? So kind of thinking about what are maybe some of the barriers to this human showing up for you in the way that you need. And sometimes, my youth, adolescent, whatever, is like, it's to me, it doesn't feel safe to do that. There's barriers that like are bigger than just education, right? You said conflicting values, beliefs. So I think first it's checking in, does it feel helpful and safe for the client to bring in all the family members, right? Even the ones that might be struggling, because then it kind of is like this fun, like, I get to help you educate. I get to step in as more of an advocate role for you in this space, where if education is the thing, right? Like, help me kind of amplify your voice to be able to educate. Because I think it's exhausting to be the person going through, your own journey, and also have to be the person that has this emotional labor then of kind of educating. So I kind of explained that piece. And it's also, if I'm being told I don't feel comfortable with this person coming in yet, right, or ever, it's honoring that as well, knowing that maybe we'll get to a place where they feel more comfy with that. But I think first we really got to assess kind of like, again, the grief and knowing how we want this person to show up for us and what maybe some of the challenges or barriers might be. And sometimes, again, it takes time, right? Like, I have to also remember that, family members, they're doing the best with what they have in those moments. And so I think most of the time youth understand that. And that doesn't mean that their own grief around like, gosh, this is really hard navigating this, isn't also going to be present.
And grief is such a powerful word for that. And so can you share more about, the purpose of that word, right? And
Yeah.
in this context?
Yep. I think, oh goodness, I think, when I think about the relationship of whether it's parent, typically I'm working with parents and right the family system, but even just caregivers, right? Like there's I think this innate drive obviously for us as little humans to be in connection with our caregivers, our parents, our family. It's just innate. So the sense of unconditional love, secure attachment, right? Like these humans love me no matter what, no matter my struggles with an eating disorder, mental health, my identity, if that changes, my pronouns, my expression in life, right? Like that sense of knowingness is just innate, and it's innate need in us, right? So if there's cues, right? Because again, we're very smart as humans. If there are either unconscious or conscious cues that are provided that we are only accepted if blank, it feels again really like there isn't this piece of unconditional love. So I think then it's processing just kind of like this grief around like I need this connection with these humans that can't be, found in just other spaces. Luckily, I think there's a lot of work that can be done around connecting with other spaces, especially I think when I work within this community of LGBTQIA experiences, oftentimes it is like my family might not be safe for me to be connected or find that connection. So it's getting real creative and finding how then we create those spaces for ourselves. But I think we first really got to address that underlying grief that I think is present. Yeah.
And, because you mentioned that like larger community piece, like in some ways stepping in and healing in that context, especially adolescence, like that is a huge part of that phase of life is, connecting and making friendships. And so with the youth that you've worked with who are LGBTQIA plus, how have you seen that larger community or those friendships playing a role, in their healing or their support and process for the eating disorder recovery?
Yeah. I think to me, and this, I think for me, I have like a sense of sadness and also like celebration that I think on one hand, it's really challenging for my youth to be able to connect to that broader sense of community for multiple reasons. But I think about like, again, if we're navigating, maybe again, a school system or environment where we're at different clubs or however we're navigating our environments, it is not always, again, something that's celebrated to be different. So sometimes, and it doesn't happen until later that we're really able to step into like, this is not something that is inherently wrong with me. Like, I celebrate this part of myself. Like, I think at that age, developmentally, again, our drive to fit in kind of overpowers our ability to feel safe and being authentic. So I think like we have to acknowledge that first. And so it's like the sadness that I have to recognize that some of my kiddos really struggle understandably with like being able to connect to other humans who also share similar identities or intersecting identities. I have worked in IOP spaces for specifically adolescents navigating eating disorders. And I think that to me, like I get so like, I don't know, nerdy about it because it was so beautiful getting to watch these humans connect and be like, oh, you get it, right? Maybe for the first time in our lived experiences. And I think that to me, it still gives me goosebumps because I think support, and we always talk about this at different levels of care within therapy, it's such an integral part of being able to survive and to be, in successful recovery. But it's also then how do we help humans of all walks of life find safe support? And I think that just is like an additional barrier. So I think once we can find that and we have that, like it's that bond. Like I think of some of my youth who have maybe one or two very close friends who understand like that they're like siblings, right? Because it's just this bond that like you get it, I get it. That really can't be recreated anywhere else. But I think, gosh, there are so many barriers to just being able to find that support in the first place. So I think it's something that we talk about, like it's very easy to create and I think that there's lots of challenges I've noticed just in like helping my youth find what that support can look like, whether it's, again, peers or even family that understand, etc.
And you mentioned the IOP, and so sort of these different models or levels of eating disorder treatment. And eating disorder treatment can often feel very much at odds with gender affirmation. Now, I say that with many layers of privilege, and that includes being straight and cisgender. But I have heard that a lot from the trans and gender diverse youth that I've worked with. So, what should caregivers keep in mind, and all of us keep in mind when it comes to things like body changes or weight restoration or general expectations in the treatment process?
Yeah. Yep. I think, for caregivers first, I think it's acknowledging that it is going to probably take some concerted effort to find whether it is a treatment center or a therapist or a life coach. I don't care what it is, a doctor, a PCP, right? Like, I think there's a difference between saying that we tolerate LGBTQIA community members and that we affirm them. And so I think really using, right, whether it's a 15-minute consult call or a meeting with, the provider first before we even bring in our youth, so that we can make sure that it is going to be somewhere that and someone that can really celebrate and affirm your loved one. I think that in and of itself can just be a huge first step. And making sure that, again, we're looking for resources that are really going to be supportive and provide, your youth with that lens of, like, again, do no harm. I think that the next piece is typically when we're navigating, I think, our journey within eating disorder recovery, there may be, and there isn't always, but there may be, like you said, body changes. And that in itself can be very alarming to an individual whose gender representation, whose ability to navigate society as the gender that they, again, identify with, that could then alter that or change that. Or now people are misgendering them. They're not using the right pronouns. So I think it's recognizing that, again, eating disorder has so many different functions. And as body changes, that can bring up a lot of pieces that need to, again, kind of be addressed in that therapeutic sense or with dietitian or with medical provider, whoever we have access to, that may potentially come up. So, and I think, again, to an outside perspective, they might not understand that or really understand what's happening internally for someone. They might be like, again, like, nothing has changed externally to the person, but internally to your loved one, it feels like everything's changed. And we have to really honor that. And that's where I think, again, like, being able to have support around that is going to be really imperative.
And, because you mentioned like looking for therapists and providers, doctors, psychiatrists, dietitians that are affirming and not just tolerating, the word that you used, what, from your perspective, can we as providers do to better support the youth we're talking about and their families too?
Yeah, I think the first piece is, I think at any space, whether it is an intersecting identity, a minority group, a person with a just lived experience that's different from mine, the first term that comes to me is cultural humility, right? Of like, I, as a privileged white human, am not going to know all the things. And I think that it is ridiculous to think that I will know all the things. Thus, it's really important for me to name that. Right? How is it for me to, again, be able-bodied in this space? How is it for me to show up again with my whiteness in this space, with my lived experience, knowing that, like, your lived experience, that's what's going to be centered in this space. So really trusting that the lived experience of this individual is their experience. And if I'm not really understanding something about that, or I have questions, right, like asking, and doing my own work then of consulting with individuals who have an understanding of that space, right? Like doing my own research. And again, being very mindful that it is okay to say I don't know something and not putting the emotional labor on your client to then teach you all of the things, because that's exhausting, right? So I think just kind of us knowing and acknowledging that we're not going to know all the things, and that's okay, and really leaning into that of how can I learn more about these spaces that maybe I'm not as familiar with, because no one expects us to know it all. And I think as much as I would love to say that like I learned all the things that I needed to help every single human in my master's program, oh, I was ill-equipped, girl. That's okay, right? Like I think as a baby therapist, there's just like this sense of like I need to know it all, and that's the beautiful thing is you don't, right? Like we're gonna learn, but I think hardly any of that learning came from my actual higher, level of degree learning. Yeah. Yep.
Yeah, it's funny you say that because I do feel there's like this process that happens of becoming actually more comfortable with the fact that you don't know and letting that guide like what we're learning, how we're showing up. And absolutely, I resonate with that.
Yeah. Good. I'm glad. I feel not alone. Thank you.
Yeah. And then, in the spirit of that idea, right, of learning and being open to having our ideas or conceptions of things being challenged, there are so many myths about who gets eating disorders. And so can you tell us about some of the biggest misconceptions about eating disorders in the queer and trans communities that you wish more people understood?
Absolutely. Yeah. I think specifically, not just within the LGBTQIA community, but I think there's just lots of misconceptions that, again, eating disorders impact only affluent, white, right, younger youth, right? Or again, like just female presenting humans. And that is not accurate, right? As we know that eating disorders don't discriminate. So anyone can be impacted and be navigating an eating disorder. I think it's also thought that, someone navigating an eating disorder, it's going to, again, be visible in their physical appearance. So they're going to be malnourished, and malnourishment's going to look like being in a smaller frame or lowered weight. And that also is wildly inaccurate, that someone can be malnourished and struggling with any type of eating disorder at any type of body presentation. And so I think specifically then in the LGBTQIA community, I think, again, especially when we look at intersecting identities of different racial backgrounds, again, different types of able-bodiedness, right? Like, and then we put in this piece of, gender expansion. So many individuals are struggling. And because maybe, again, we don't know the questions to ask as a medical provider or a therapist or whatever, it gets missed. And I think it's helpful to think about, right, like looking at the statistics or looking at the data, but I also think that it's drastically underreported as far as who actually is navigating eating disorders, disordered eating, because typically, again, how are we gathering this data and who are we actually including in these research, cohorts? So typically, we're not making sure that then we are including different gender identities. And, again, some of the surveys I get, it's just check this binary of are you male or female? And I'm like, yikes, we're really missing then lots of individuals that don't identify just within those two places. And we don't have accurate data. So, I think, again, it's just like there's lots of myths. And I think just being really open and kind of knowing, again, like what are some of the questions that we can be asking that don't just continue to perpetuate the stereotype that it's just this one type of human that's going to be struggling with an eating disorder.
Yeah, and you said something so important in there about like research. And so much of our understanding, as a professional community, but also in the world is based on a very limited amount of research about a very limited amount of people and experiences. And so, I think unfortunately, as professionals, but also family members, what they're reading or what they're consuming about eating disorders, are reflective of all the ways that can look. And so I appreciate that point that you make. I think that's important. So, is there anything that you wish more on like a broader scale, whether it's about eating disorders or LGBTQIA plus youth, that caregivers knew about what it means to show up truly for a young person going through this?
Yeah, I think the first thing, I don't know why that comes up for me, but I think it's just important that I name is, again, just believing you're human, right? So I think sometimes there's this idea that if someone shares that they're navigating maybe, again, their relationship with their pronouns or how they identify, they're too young. They have, right, like so much lived experience that they still need to go through. How can they really make that decision now? And so I think for me, really leaning into, right, like if we believed them, what's the worst that can happen, right? If we can believe this human that's telling us about their experience, I think as caregivers, of course, there's this immediate, right, I want to protect my loved one. I want them to have this beautiful, enriched life. And I think for me, right, like there was this idea maybe with like other people navigating my coming out story, right, of like, well, now your life is going to be so hard. Are you sure you want to do that? And it was like, oh, friends, this is not a choice. Trust me. If I could choose to have the easier way, I would. Right. So it's, I think, recognizing that people live enriched, safe, beautiful, whole lives when they can be their authentic self. So I think believing you're human when they say they're struggling with an eating disorder, right? Like that is something, again, we're not using this for attention. It's not a phase. It's not something that they're going to grow out of as such, right, with gender expansion, pronoun use, their sexual identity. I think believing them and helping them navigate that and having, again, dialogue around that is going to, again, help them navigate that in a way where they know they have support instead of it having to be this very shaming, scary, closeted process.
Mm-hmm. And, I think with this piece around how you approach the youth that you work with, I also think that something that's really valuable in the way that you're sharing the work you do is also the compassion that you clearly have for families and not just like alienating them or, dismissing them or whatever their fears and concerns are, but inviting that to be part of it. It's just so important, I think, in this work.
Yeah, because I think they're very valid, right? Like the safety of your loved one is a valid fear, right? Like I think there are spaces that my partner and I in Arizona don't go to because I'm like not going there past 7 o'clock, right? Like it's a very valid thing. And I think, again, like you said, I think when we internalize all of that and not name it, not talk about it, it's going to come out in a way that, again, sometimes it's just you're sitting with that and it's going to come out in a way where maybe it's not helpful. So I really just invite, right? Like if your child doesn't understand your fears, then it could just, again, come off as you're just like have a wall to this process. So I think when we can verbalize that, they're going to know, like, no, they really care about me. They have valid concerns. It's not that they don't want me to be my authentic self. Yeah.
And, of course, you mentioned Arizona, and we're both, living in Arizona. And of course, anywhere in the world, there's a lack of safety and support for the youth we're talking about now. And then especially so in Arizona, it's a very conservative state. And so, with youth who are hearing and experiencing and absorbing the context in our world right now and in Arizona, especially, and what spaces are safe and not, how can caregivers talk to them about this or support them, knowing that there's so many layers, right, that they're living in?
Yeah. Yep. Yeah. I think that's such a beautiful question, right? I think it's acknowledging that there is a lot going on right now that you as a parent are going to be navigating, and also your youth. So I just have, again, a lot of compassion that I think we can't like DBT our way out of the fact that there is like safety concerns, there is discrimination, there is, right, like not laws in place that it's like, we don't have to hire you if you check this or this, right? Like that all exists. So I think it's one, acknowledging that and not, again, not naming that and being able to talk about that. And also, I think then safety, security can start then within that environment of home, of parent-child connection, of caregiver, right, and youth connection. That gets to start with us. And I think for me, knowing that the world was going to have its own, right, opinions, ideas, whatever, like knowing that I had humans that supported me, I think for me mentally, my psyche, then it was like, I know I'm safe because I have this. and I'll figure out the rest, right? Like, and so I think just having that baseline of that secure attachment, that lovingness, the again, unconditional love and support, I think then it's like, okay, that's met, that need is met. So now we can be able to kind of navigate how do we navigate this? And where can we create spaces for you that again are more safe-ish? I think, again, safety is a construct. So there's going to be unsafe spaces in even the safest states. And being able to, again, find our humans, knowing as, again, our community resources, that if we feel like, again, we're not safe, like what can we access to make sure that we can take those precautions to be able to protect ourselves? Having plans, right, as family members, right? Like I'm always like, all my friends share the location. We know who to call, right? Like we know what emojis to use. We know what code words to use, that if we feel uncomfortable at any given moment, right, like we have those ways of communicating. And also, right, like this is kind of our central space that we go to, right, whatever it is. So I think also kind of having those safety plans then within the home of, if you're at school and you're feeling not comfortable, right? Like this is how we can navigate this. Or if you're with friends, or right, just those different safety plans maybe laid out. So you as caregiver feel 1% less scared. And, your kiddo might roll their eyes, because I know I did, where I was like, yes, mom, okay, I'll call you if I need anything. But gosh, when I did feel uncomfortable and I knew that I could call her and still, right, like she'll still be like, hey, if anything weird goes down, right? Like just use me as an excuse, right? Like that I think is so helpful to know, because they'll use it, right? Like I know that I could call mom or grandma or right, Auntie Cynthia, whoever, so that I can make sure I'm safe.
Yeah, and that's a good point of like attachment is not just like physically being around or in the room. It's also this like mentalization of I know this person is accessible to me or there, and when they're not physically, and how far that goes, not just when we need it, but also when we don't.
Yeah.
Well, Winter, you shared so much with us, and I really appreciate it. And you did touch on this, in much of what you said, but I would just like to hear from you, like what drove you to this work, and what informs the work that you do with the youth we're talking about.
Yeah. Gosh, and like what part of my life has not informed this? Is probably the better question. So myself, I have my own history of eating disorder recovery. And so I think that, at first, when I first kind of think about my journey into therapy, I have to first name that's been such a helpful piece for me. I think oddly enough, right, like when you ask, little me, I was like, I'm going to be an astronaut. I'm going to, right, like I had all those answers, but I can remember as young as 12 being like, oh, like I'm going to help people, whether it's whatever capacity that's going to look like. So there was this weird knowing for me that's like what I wanted to move into. Later, right, then after kind of lived experience, went in and got my bachelor's in psychology, and then didn't know, right, like what kind of area I wanted to support humans in. And then I remember, seeing a position post for an eating disorder recovery space and being like, well, what the heck? Let's see how this is. And it was just, again, like one of those moments where I'm like, oh, I can't see myself not working in this space now. Like this is just exactly what my passion is. And yeah, I'm just so grateful that I, again, get to do this really meaningful work. And again, my own then lived experience within being in the LGBTQIA community. And just, again, I feel like I really love working with families, because I was really, really blessed to have at least, again, one securely attached caregiver, where it just takes one, and that safety, then I just feel like propelled me in being able to be my authentic self. And so really feeling like, again, our youth have, hey, just one human that they can be like, all right, this is my little advocate. I know that like this person is safe. I know what that looks like now. I can find that in the community. I think that just is such a powerful piece. So just being able to help families navigate that. So I love working with youth who are navigating eating disorders, LGBTQIA. I also just love working with families if they have questions or want resources. Again, it's like my weird special interest is connecting people to resources. So all of the above I'm into.
Well, as a social worker, I love that. And I will say, the last question I was going to ask you about was resources. And before I even got to ask you, you sent me an amazing list.
Yeah, so not me being like, I'm not going to be able to remember any of these. So yeah, lots of resources. I think like for my first thought goes to for people wanting to kind of navigate, eating disorder piece. I think I had sent you Right Sick Enough, which is one of, I think, just a really helpful starting point of kind of learning more about that piece. For families specifically, Feast, FEAST. They do really great work with just having a bunch of different resources for families. Alliance for Eating Disorders also does as well. Trevor Project. I think we have Prisma, who's out here, and 1 in 10. So there's different like local resources that are doing amazing work just again for supporting LGBTQIA youth and their families. So there's some local ones too. Even when they're hard to find, we will scour and find them. So yeah.
Winter, again, thank you so much for joining and being a part of today's episode. You are a huge asset to your community, to the lives of your clients, and of course, our network of eating disorder professionals. So it's been very special to have you here. And for those who are listening, please check out Winter's bio and their amazing list of resources in the description of this video. I hope you all have a great day.